live, someone asked, Megan Reed asks, is a vaccine in 18 months realistic? I heard no, there's no vaccine for cold, for example. And if not, then how do we get out of this? Anybody want to take that one?
I can take it. So at a lot of my students here at the business school go into the life sciences. So in my classes, we talk a lot about the data requirements for the FDA, and it's pretty amazing actually that there is already a shot in a human arm for the vaccine. So that should give us hope, right? That it is literally in humans right now. You know, you read people who are experts in FDA regulation, and they think that 18 months is doable. It's optimistic, but it is doable. So again, I don't have a crystal ball, right? This is my favorite thing that Dr. Fauci says. I don't have a crystal ball. I can't predict the future. But unlike the herd immunity scenario where, yeah, I don't think we're there, like the vaccine, on the vaccine front, I hold out hope, given that there is a vaccine in a human arm and that the FDA is working pretty hard to speed this through regulatory review. And fortunately, we don't have all of our proverbial eggs in one basket, right? There's over a dozen vaccine candidates right now, and that kind of grows by the day. So I am hopeful on the vaccine front. Others?
Yeah, I'll just say I agree. It's not, vaccine development is not my particular area, but I know at Oxford there's a team that works on vaccines regularly and had worked on MERS and the other SARS vaccines and felt like they had a really good candidate, kind of that they could ramp up quickly. And this seemed really optimistic to me, but they claimed there might be something by September and that they're already ramping up doses that if efficacy was proven, that they'd already have ramped up production. So that may be super optimistic, but the fact that they're confident enough to even say that, I think is a good sign that with all of the great talent, putting their heads together for this, I feel like we will get there, but possibly, yeah, it'll be a little bit of a wait.
Yeah, and to amplify what you said, John, the rate limiter here isn't necessarily the science, right? It's you just have to wait to see vaccine safety profile. You just cannot speed up a study about safety, unfortunately. And again, I wish that weren't the case. So I think what we're going to see with the lag is we just have to have a sufficient amount of time and numbers of populations tested to get a robust enough safety profile to actually scale.
Great, thanks to you.